risk factors? I think we have a graphic here. If we can take that and you can walk us through some cholesterol risk factors that we should be on the lookout for.
Sure. Well, obviously, cholesterol is that which is circulating in the bloodstream and is impacted and accelerated in terms of plaque buildup when the person with high cholesterol has other risk factors like high blood pressure, which we're going to talk about, prediabetes, which is just the state that occurs between normal blood sugar levels and diabetic levels, obesity and a sedentary lifestyle clearly increase your metabolic risks and the risk of developing atherosclerosis. And certainly people ask me all the time, doctor, what's the single most important thing I can do to prevent myself from getting a heart attack at a young age? And the answer is stay young and pick your parents very, very carefully. So family history and age are really, unfortunately, non-modifiable risks that have an incredibly important impact because as we get older and based upon our genetic code, we really are the two non-modifiable risk factors that most impact on our risk. So as we get older, or we have a bad family history, it becomes even more important to pay attention to the modifiable risks like high cholesterol, high blood sugar, and high blood pressure.
So in that list, if you have maybe more than 1, 2, 3, will that even increase your chances even more? So
there's something called an exponential curve. So 1 + 1 doesn't equal 2. So if you have high blood pressure and high cholesterol, your risk doesn't go from 2-fold to 4-fold, which would be double, but it goes from 2-fold to about 8-fold, which is that, as we remember from high school math, an exponential increase. If you have 3 risk factors, it's not 1 + 1 + 1 = 3, but it could be an 8 to 16-fold increase. So the more risk factors you have, the more likely you are to develop a coronary heart disease. And certainly the worst risk factor of all is cigarette smoking. So if you're a smoker and you can't stop, it even becomes more important to get your blood pressure, blood sugar, and cholesterol under control.